In a quiet rural village, a 60-year-old woman walked into a hospital, complaining of persistent abdominal pain. For years, she had attributed her discomfort to everyday issues, perhaps indigestion, maybe gas. What she didn't know was that her body harbored a secret so rare, it would leave even seasoned doctors astounded. The skeletal remains of a fetus had been inside her for an astonishing 36 years. This is the extraordinary and tragic story of a stone baby, a medical phenomenon that blurs the line between science and mystery. It all began with what seemed like ordinary symptoms. The woman, who was postmenopausal, had grown accustomed to minor aches and pains with age. But over time, her discomfort became persistent and unusual. She felt an unnatural fullness in her abdomen, struggled with chronic constipation, and found urination increasingly difficult. At times, she experienced strange and unexplained symptoms, occasional bouts of bleeding, and a peculiar sense of pressure in her lower abdomen that she couldn't ignore. After years of brushing aside these issues, she finally sought medical attention. Initial tests, including blood work, revealed anemia and other non-specific findings. Still, doctors couldn't pinpoint the source of her discomfort. Then they decided to conduct imaging studies, including an abdominal CT scan. What they found defied all expectations. A well-defined sac containing skeletal remains. The fetus appeared fully developed, as though frozen in time, a haunting relic of a pregnancy that had ended over 3 decades earlier. As doctors unraveled her medical history, a heartbreaking story began to emerge. 36 years earlier, the woman had been pregnant with her 5th child. She recalled feeling her baby's movements during pregnancy, until, at around 37 weeks, they abruptly stopped. Devastated, she sought help at a nearby clinic, where doctors confirmed her worst fear. Her baby had died in utero. In an area with limited healthcare access, she was advised to undergo surgery to remove the fetus. But overwhelmed by grief and lacking proper resources, she sought alternative treatment from a local healer. When those efforts failed, she eventually gave up on seeking medical intervention. Over time, her abdomen shrank, the symptoms disappeared, and she believed her body had somehow resolved the issue. She moved on with life, unaware that the lifeless fetus was still inside her, undergoing an extraordinary transformation. The woman's case was identified as a Lithopedion, also known as a stone baby. This rare phenomenon occurs when a fetus dies during an abdominal pregnancy, a type of ectopic pregnancy where the fertilized egg implants outside the uterus, often in the abdominal cavity. Unlike uterine pregnancies, abdominal pregnancies lack the protective structure of the uterus, making them far more dangerous. When a fetus dies in such cases and cannot be expelled, the body reacts defensively to protect itself from infection. It calcifies the fetal remains, encasing them in a hard, stone-like shell. This process can take months or even years. Lithopedion cases are incredibly rare. Fewer than 300 have been documented in medical history, with some dating back as far as the 16th century. In most Lithopedion cases, the fetus becomes entirely calcified. However, this woman's case was even more unusual. Instead of calcification, her fetus had undergone skeletonization. Over time, her body absorbed the soft tissues of the fetus, leaving behind only the skeletal structure. Remarkably, the bones were preserved in almost pristine condition, making this case even rarer. Skeletonization is a less common outcome of abdominal pregnancies. The process occurs when the body's immune system breaks down the soft tissues and fluids, but does not trigger the calcification process. The result is a fetus that remains eerily intact as a skeleton, encased within the mother's body for decades. One of the most perplexing aspects of this case is how the condition went unnoticed for over 36 years. The answer lies in the nature of abdominal pregnancies. Early symptoms such as abdominal pain, nausea, and irregular bleeding often mimic other conditions and may not raise alarms. As time passes, these symptoms may diminish or disappear entirely, making the condition nearly impossible to diagnose without imaging. In this woman's case, the fetus's presence caused no significant symptoms for decades. It wasn't until she began experiencing pressure-related issues such as constipation, urinary difficulties, and abdominal fullness that doctors suspected something unusual. Modern imaging tools like CT scans and MRIs were key in solving the mystery. The CT scan revealed a fetus-like structure consistent with a pregnancy near full term, preserved in a sac within her abdominal cavity. Medical literature describes 4 possible outcomes for an abdominal fetus that is not removed. Skeletonization. The soft tissues dissolve. Medical literature describes 4 possible outcomes for an abdominal fetus that is not removed. Skeletonization. The soft tissues dissolve, leaving behind only bones. Adipose hair formation. The fetus transforms into a waxy, soap-like substance due to the breakdown of fat. Suppuration. The fetus becomes infected, potentially leading to abscesses or ruptures into nearby organs. Lithopedion formation. The fetus calcifies, forming a stone-like encasement. Each outcome depends on factors such as the location of the fetus, the mother's immune response, and the duration of retention. The woman's case of skeletonization is among the rarest documented outcomes. The rediscovery of the fetus decades later likely reopened deep emotional wounds for the woman. The death of her child all those years ago was a tragedy she had learned to live with, and the shocking discovery of the fetus likely resurfaced feelings of grief, guilt, and disbelief. Cases like these highlight the importance of psychological support alongside medical treatment, especially when dealing with rare and traumatic conditions. The standard treatment for Lithopedion cases is surgical removal to prevent complications. Retained fetal remains can press against nearby organs, causing symptoms like the ones this woman experienced. In her case, the skeletal fetus had begun to exert pressure on her bladder and intestines, making removal essential. Following the diagnosis, she underwent successful surgery to remove the remains, alleviating her symptoms and closing a chapter on a mystery that had haunted her body for decades. The story of this woman and her stone baby is both tragic and awe-inspiring. It underscores the resilience of the human body, the complexities of medical science, and the profound emotional toll such conditions can take. Her case serves as a reminder of the importance of accessible healthcare, early diagnosis, and advanced imaging technologies in uncovering hidden medical mysteries. This astonishing tale also invites reflection on the mysteries of the human body and the stories it can hold for years, sometimes decades. What do you think about this rare condition? Have you ever heard of a Lithopedion before? Let us know your thoughts in the comments below. And if this story captivated you, don't forget to like, subscribe, and share for more intriguing medical tales.